Good morning, everyone. Thank you for joining us today. This is the Rock County Public Health Media Briefing for January 20th, 2022. This briefing is being streamed live on the Rock County Public Health Department's Facebook page, and the recording will be available afterwards on our Facebook page and also our YouTube channel. My name is Jessica Turner. I am the Communications Specialist for the Rock County Public Health Department. And joining me today, I have Nick Zupan, Epidemiologist, Seth Longcar, Administrative Services Supervisor, and Kelsey Cordova, Public Health Supervisor, who supervises our communicable disease team. So we will start with some COVID-19 updates from our panelists, and then we will open it up to questions from the media. So I'll start by turning it over to Nick Zupan for some data updates.
Thanks, Jessica. So recently we've seen ongoing increases in COVID-19 case activity. Over the course of the pandemic, we have seen 31,516 confirmed cases of COVID-19. Recently, we're averaging about 450 new cases per day over the last week. The state recently indicated that they were dealing with a backlog in confirmed cases. They implemented a fix last week to clear up that backlog. So last week, you may have seen daily increases that were rather large. So that backlog did elevate some of the daily increase in case activity. Since then, that fix has kind of smoothed out the system, and we're seeing more consistent daily increases. So still averaging about 450 new cases per day, which is very, very high at this point. We're also seeing about 120 new probable cases per day over the last week. So seeing both people testing at home and getting that laboratory test in high volumes at this point. And we have about 6,800 known active cases in Rock County. Most recently, there were an increase in the deaths due to COVID-19. So total deaths to this point are 275. Over the last week, we saw an increase of about 7 deaths. And we are actually seeing a decrease in the number of people who are in the hospital. Part of this is probably due to the deaths that have occurred. Those people who were in the hospital for a long period of time ended up passing away, would lead to a decrease in hospitalizations. But we're also seeing other individuals being discharged from the hospital. So as of today, we have 46 patients in the hospital getting care for COVID-19, which represents a pretty significant decrease in our hospitalization rate, which is great news. Last week, we were kind of in the mid 70s in terms of our hospital patient census. So I'm hopeful that these trends continue. In terms of our vaccination rates, we have 63% of the Rock County population having received at least 1 dose of the COVID-19 vaccine, and about 59% have completed the original vaccine series, which is 2 doses of the Pfizer or Moderna vaccine, or 1 dose of the Johnson & Johnson vaccine. And about 28% of the population have received a booster at this point. So that's all the data that I wanted to share for the briefing today. Thank you.
Thank you, Nick. Next, we'll go to Seth for some additional COVID-19 information.
Great, thank you, Jessica. Before we share some COVID-19 testing updates, we want to talk about Rock County's recent surge in positive cases and how that impacts contact tracing. We've been operating under crisis standards for contact tracing for some time now, which means we're not able to reach everyone with information in a timely manner. This also means it's critical for anyone who tests positive to reach out to their own close contacts as soon as possible to help us contain the spread. As we now know, the Omicron variant is highly transmissible, and we've seen exponential growth in infections, which has been overloading our healthcare systems, in addition to causing disruptions at schools, businesses, and other institutions. Rock County's hospitals continue to operate at or near capacity on a daily basis. As we head into one of the busiest times of the year for hospitals in our region, it's crucial that the community stays as healthy as possible to prevent visits to the emergency department and hospitalizations. Now is more important than ever to get tested and get vaccinated to ensure that all who need inpatient care are able to receive exceptional service that is close to home. Working together, our goal is to contain the spread of infection to reduce Rock County's case counts and prevent additional strain on our healthcare systems. In our effort to mitigate and contain COVID-19, especially given the spread of the Omicron variant, the importance of continued testing cannot be overstated. Individuals should get tested if they have symptoms of COVID-19, if they've been in close contact with a confirmed case, or If they have taken part in activities that put them at higher risk, like travel or attending large gatherings, particularly in poorly ventilated indoor settings. If an individual has had close contact with someone who has had COVID-19, they should get tested 5 days after exposure, even if they don't have symptoms. This is recommended for both unvaccinated and vaccinated individuals. Those who test positive for COVID-19 should isolate for 5 days and then wear a well-fitting mask around others at home and in public for an additional 5 days, as long as they have been fever-free for 24 hours and other symptoms are resolving. Since someone can be contagious before they know they're positive, it's important that they notify anyone who they had close contact with in the 2 days prior to onset of symptoms or testing positive if they do not have symptoms. Those who are in close contact with someone who tested positive for COVID-19 may need to quarantine for 5 days. Those who are identified as close contact should quarantine if they have completed the primary series of a COVID-19 vaccine, but have not received a recommended booster shot when eligible, or if they have not completed a primary vaccine series. Those who need to quarantine should also monitor for symptoms, wear a mask around others at home and in public, avoid anyone who is at high risk for severe disease for a total of 10 days, and get tested after day 5 or if they start to show symptoms. I know this may seem a bit repetitive, but given recent CDC changes to quarantine and isolation recommendations, we want to ensure everyone has all the information needed to best prevent getting or spreading COVID-19. Given the critical importance of testing, we are happy to announce that there will be another free COVID-19 testing option in Janesville. Summit Clinical Laboratories will be offering free COVID-19 testing at 3530 North County Highway F, Monday through Friday from 8 a.m. to 4 p.m. and Saturdays from 8 a.m. to 11 a.m., beginning Monday, January 24th. Patients should bring along ID and, if insured, insurance or Medicare cards. COVID-19 testing will be provided at no out-of-pocket cost to anyone who is having symptoms or think they have been exposed. Walk-in and by appointment testing will be available. To pre-register, Rock County residents should visit register.covidconnect.wi.gov. The U.S. government also recently launched a new service that allows all U.S. citizens to order up to 4 free at-home COVID-19 tests. The test will usually ship in 7 to 12 days. Although they are not appropriate in all situations, at-home tests can be convenient and a fast testing option. If you test positive on a home test, it's a good indicator that you have COVID-19 and should isolate from others and notify close contacts. If you test negative, it means the test did not detect the virus and you may not have COVID-19, but it does not rule out infection. For a more accurate picture, it's recommended that you repeat the test at least 24 hours later or seek a confirmatory PCR test. This is especially encouraged if you have symptoms or have been in close contact with someone who has COVID-19. All Rock County residents are encouraged to order the free test so that convenient testing is available when needed. Visit www.covidtest.gov to learn more and order. And as things change quickly, we also encourage everyone to visit our testing information webpage at rebrand.ly/rcphd-covid-testing to find the most up-to-date convenient testing options in Rock County. Finally, if you've not already been vaccinated or boosted, we encourage you to do so immediately. Vaccination is still our best tool in the fight against Omicron and other variants, as it helps prevent severe disease and hospitalization. We're continuing to offer free COVID-19 vaccinations every Wednesday from 3 p.m. to 7 p.m. at our North office, located at 3328 US Highway 51 in Janesville. Appointments can be made by visiting rebrand.ly/rcphd-covid-appt. Walk-ins are also welcome. The DHS and AMI hosted community-based vaccine clinic located at 1900 Center Avenue in Janesville also continues to provide free vaccinations Tuesdays through Friday from 11 a.m. to 7 p.m. and Saturdays from 11 a.m. to 3 p.m. Registration for this site is available at vaccinate.wi.gov, though walk-ins are also welcome. Visit rockcountyshot.com or vaccinefinder.org to find a provider and a location that works best for you. Also, if you need a free ride to a COVID-19 vaccine clinic or appointment in Rock County, call 211 for assistance. With the surge in COVID-19 infections, getting vaccinated and boosted, and getting tested if you are exposed or have symptoms is more critical than ever. Back to you, Jessica.
Thank you, Seth. That concludes the public health updates for this briefing, so we will turn it over to questions from the media. Looks like we have one media participant today joining us via phone. I don't recognize the phone number, so we will give you the ability to unmute yourself. You can let us know who you are and go ahead and ask any questions that you have.
Hey, Jessica, it's Austin Montgomery, Beloit Daily News here. I'm just calling in from our conference room line. It's just a different phone number. Sorry for surprising you guys there. I just had a couple questions for Nick. He answered one of them about the percentage of booster doses for people in Rock County, but my other question was, is there an estimated timeline for the possible kind of peak of the Omicron surge kind of locally? I know we're seeing some things out east where they're starting to see some cases be lower, case rates be lower. Just wanted to see if there was an estimation on when the timeline might change and we might start to see some decrease in cases.
Sure, yeah, I've been getting that question quite frequently, relatively recently. So I guess the short answer is I don't know exactly if they're like when the peak will occur, but based on some of the modeling that has occurred nationally and for the state of Wisconsin, it's looking like the peak has been projected to occur before the end of the month here in January, and then things should start to level off and decrease in terms of case activity and hopefully hospitalizations and deaths as well follow that trend. It remains to be seen exactly when that peak will occur, but I'm hopeful within the next couple of weeks here, we'll start to see some trends moving in the right direction where we'll see decreased case activity. Right now, we're seeing extremely high levels of cases. We saw a recent decrease in hospitalizations. With the Omicron variant, we do have some preliminary evidence from elsewhere that there is the potential for fewer severe cases and fewer deaths due to the Omicron variant, but until we get there, it's really hard to know how that will play out locally. So I'm hoping that in the next few weeks here, we'll start to see a decrease in case activity and see the trends move in the right direction.
Thanks, Nick. I appreciate that. Jessica, I'm not sure who to direct this question to. It's just related to masking. I know we've recently, the CDC has come out and talked about the difference between N95 masks, KN95 masks, and their effectiveness against Omicron compared to like surgical masks. Does the health department have any updated guidance for masking or anything that you guys would want to get out there just to talk about masking in general, since we've seen kind of a shift in what might be most effective for people who have been wearing masks all along, but might need to be considering maybe making a switch to a different type of mask?
Thanks for that question, Austin. This is Jessica. And thank you for giving us the opportunity to give some information on this. I can start by providing an answer, and then Kelsey, if you or anyone else has any additional information to add, feel free to jump in. But what we've known all along is that the KN95 and the N95 masks are the most effective against this virus and many other respiratory viruses. That is the type of mask that is most often used in healthcare settings. Towards the beginning of the pandemic, there was a shortage in supply, so we were asking people to reserve that type of mask for those healthcare workers who were more likely to have direct contact with the virus and needed those supplies to protect themselves from the virus. But now that we have a greater supply of those masks. Those N95 masks are great. They are the highest quality that we have to protect against the virus. So if those are available to you, that's a great option. And we especially encourage those for people who are coming into contact with people who have been diagnosed with COVID-19, excuse me. The next step would be the surgical masks. Those also provide good protection against the virus. Not quite as much as those N95 because the N95s have a tighter fit, but they do provide good protection against the virus. And then the cloth masks then would be the kind of the next level. And they do still provide protection against the virus, not as much as those surgical masks and the N95 masks, but they are most certainly better than nothing. And they do provide some protection, especially if you are wearing one and the other person that you are in contact with is also wearing one. It does reduce the amount of those particles that are entering into the air. It kind of acts as a barrier, and we encourage people to at least wear those cloth masks, and then if possible, the surgical masks and N95 masks. All provide some level of protection, but maybe just a different level for each.
Thanks, Jessica. I appreciate that. Just one last question, just related to data. Just wanted to see when the vaccine portal would be updated today. Just wanted to kind of gauge a timeline here. I'm just working with a couple different deadlines and wanted to check in on when that might be updated. But other than that, thank you for doing this.
Sure. Yeah. So in terms of when the vaccine dashboard will be updated, it should happen sometime today. We wait for a data update from the state, which usually comes right around this time, around 11. And so once we get that information, we'll make that update. So hopefully early afternoon, we'll have the data update on the website.
Thanks, Nick, and thank you, Austin, for joining us today. So that will conclude our media briefing for today. Thank you to everybody who's been watching this on our live stream. Just a reminder that these media briefings take place every other Thursday at 11 a.m. They are streamed live on our Facebook page, and the recordings are available on our Facebook page and our YouTube channel after the briefing. If you are a member of the media and you would like to participate in a future media briefing and have the ability to ask us questions live, please send an email to media.publichealth@co.rock.wi.us, and I can provide you with the link to participate. Again, thank you for joining us. We will see you back in a couple weeks, and until then, be safe and be healthy.